Hey, this is Laura Nesbitt, and today we are going to be looking at a patient report. And my dream career is being an occupational therapist. So, an occupational therapist is a health professional similar to physical therapy, but we use occupation and meaningful activities to reach specific goals for that patient, whoever we're working with, and it's used more not to build muscle, but to be able to gain the intrinsic muscles and the ability to do everyday activities that you can do by yourself, moving forward from an accident, from a disability that you have. That's what occupational therapy is used for. So I'm going to be taking this patient from that view, looking at everything that's happened. So based on the prompt, our patient is 56 years old. They have been diagnosed with a myocardial infarction, which is also known as a heart attack. They have gone through recent bypass surgery, which we will discuss those both later, what they are, what they mean for our patient. And then the report also showed some cardiac drugs that they are on, which are known as a diuretic and a vasodilator for emergencies. We will discuss those, what they are, how they help, what they're able to do for our patient. And based on all of these factors, we are going to look at the precautions with our patient during exercise, what we're able to prescribe them, what they're able to do, and exercise tolerance with our patient, how much exercise they're able to do, what kinds of exercises, we would be able to prescribe them. And then lastly, overall, we're going to be looking at the cardiovascular effects of exercise, how a normal person reacts cardiovascularly to exercise, and how this patient would be affected through cardiovascular ways, through exercise, and yeah. So first, beginning off with our patient, he said he was diagnosed with a myocardial infarction. This means that he had a heart attack. And I'm just going to be explaining what that means, how it affects him. So, a heart attack is caused by a decrease or complete cutoff of blood flow to a portion of the myocardium. So, the myocardium is this muscle that's around, that forms the heart. So, we have different types of muscle throughout the body, but the myocardium is specific to the heart. And just like any other muscle, we need blood flow to those muscles for them to be able to be used, be able to contract, be able to work. And as we all know, without our hearts beating, without them contracting, without the depolarization, all that stuff, we would not be alive. So, myocardial infarction is a very serious issue. It can go silent or undetected, or it can be a very loud and out there, it's happening. It just depends on the person. Most myocardial infarctions are due to underlying coronary artery disease and is one of the leading causes of death in the United States. When the myocardium, as we said, these are the arteries and veins that are going through. It's kind of a rough sketch, but these are around the places where they are. But this is showing the blood getting to the myocardium, getting that oxygen to the muscle, making sure they stay alive, because when they are deprived of that oxygen, that's when we have the muscle death, which causes a myocardial infarction. And that death stays there. You can't reverse it. And we can see this on an EKG through different ways. But yeah, that's what a myocardial infarction is, and our patient has had one of these in the past. The next thing that was discussed for our patient that he has had in the past is a bypass surgery. This is one of the most intrusive surgeries that someone can get for coronary artery disease, especially if they have had a myocardial infarction like we talked about in the last part. So with this surgery, basically, they're going to open up your chest cavity, make an incision, saw that bone through the sternum, open you up, and then the heart is actually going to be stopped with a machine that carries out the CO2 from your blood, just making sure you actually stay alive. That's what keeps your body alive while your heart is actually stopped, which is kind of cool to think about, kind of scary too, which makes it a very serious surgery. So once they are able to find that artery that is completely blocked, they first take a vein or an artery from another part of the body. It's oftentimes seen in the wrist, just somewhere easy that they can use that to make a new route for blood flow, which is seen in the last point here. They are making a new route for the blood flow by connecting that artery or vein to the section of the heart where the blood flow is being cut off. So they are creating, it's like when they add a new lane to the highway. It's kind of like that. They are adding a new area for that blood flow to continue to flow instead of it just being blocked, sitting there, causing more myocardium death, causing a myocardial infarction, just causing so many bad things for the heart. And our heart needs that blood flow. So being able to create this new route is good for patients like ours. And this vein will be sewed in and everything will get working. They'll make sure it works for said patient, make sure the blood is actually pumping, make sure that it can work without the machine being connected to the heart, because if it doesn't, then there's no point of the surgery at all. But that's the whole point of bypass surgery, especially with someone who has had a myocardial infarction and they have coronary artery disease. That is the main issue when it comes to this surgery. It's very invasive, but it works. It works for these patients who don't have the correct amount of blood flow. So that's what bypass surgery is. So the two drugs, the cardiac drugs that we were told our patient would be receiving or has been taking are vasodilators and diuretics. So we're just going to go over what those are and what they will do to help our patient. So vasodilators dilate veins without exertion. Whenever we are exercising, our veins dilate so that we are able to get blood flow to the muscles that we are using. For those muscles that we are using, let's say we're hitting legs. If we want those muscles to work properly, we need an increase of blood flow to the skeletal muscle and the muscles that we are using. It's not going to be sent to our arms, it's going to be sent to our legs. So by using a vasodilator, the blood is going to be sent in all the right places. Our veins are going to dilate and get bigger. Instead of them being like this, they'll dilate, and so more blood can get through them. And then moving on with diuretics, there is a decrease in plasma volume by increasing urine outtake. So the plasma is excreted through the urine, which is why it's a diuretic, and that in turn lowers blood pressure. It lowers resting blood pressure and it lowers exercise blood pressure, because when we exercise, our blood pressure increases due to an increase in cardiac output, an increase in heart rate, an increase in stroke volume. So our blood pressure tends to increase when we are exercising, but with a diuretic, it doesn't increase as much as it would. So these are the two drugs that our patient is on. It is said in his chart that the vasodilator is only used for emergencies only, and the diuretic is used more consistently, not in the use of an emergency, when this one is used when he might feel like he's having a heart attack or having those chest pains when he's exercising or doing anything. So yeah. Now we are going to look at the precautions with exercise for our patient and the exercise tolerance of our patient, because he or she has just had a myocardial infarction followed by a bypass surgery. There's going to be different precautions, different ways that we are going to exercise these clients and these patients. So starting with the precautions of exercise, we are going to want to be strengthening the heart. So doing cardiovascular exercises rather than more strength training. Our patients should not jump right into exercise, seeing as they have had such a serious thing that has just happened to them that has changed their life. If they've done something in the past, they're not, such as cycling, tennis, football, things like that. If they have done those things in the past, they will not be able to jump right into it. So we just need to caution them on the side of starting out slow in the first couple weeks, making sure their heart can take it, making sure they're not getting too breathless, just making sure they're going slow. A way to be with them and go alongside the journey with them is by doing these exercises in a lab with them. Not necessarily a lab, but like a clinic, doing them with them, being there with them so that you can monitor their breathing patterns and their chest pain. So if you're able to look at their breathing patterns and making sure they're okay, they'll feel much safer doing those exercises with you there. And also looking at chest pain. If they are having chest pain, immediately stop. If the breathing patterns get too elevated, too much, then they need to stop. But it's just working up to what they can be able to do. So those are some precautions that we have to look at when dealing with an myocardial infarction and bypass surgery patient. Some tolerances that these patients might have to deal with is being scared to work out. That's why we do suggest being with your patient in a clinic or a lab, just to be there with them so you can monitor them. They are not by themselves, that you are monitoring their heart rate, their breathing patterns, getting their chest pain, checking their RPE, just being with them. That'll give them the comfort and the safety in that exercise. We are also not going to start with a long session. In the first couple weeks, especially, we're going to do 15 minutes maybe. And walking is a very great exercise. Walking on the treadmill is a very great exercise to start out with, just to get the person up, the person moving, because again, we are trying to strengthen the heart in a simple way of walking. Walking does such good things. And also once we start and move in the direction that they can do more things, they can start doing the things that they like. That is a good thing for them to find things that they like, just to get in a space where they feel like they are able to exercise and not dread going to exercise, or it doesn't even feel like exercise because they're having fun. Just being able to find those things for them and be that leader, leading them in the direction where they won't have another heart attack and they won't have to have those chest pains and be in that situation. So those are some precautions that we take and some tolerance for our patient. Thank you. Now we are going to look at the cardiovascular response to exercise and how this relates back to our patient that we have. As we said earlier, the increased blood flow and oxygen goes to active muscle. So when we are at rest, our blood flow goes to the digestive system, our kidneys, our muscles, and our brain. But when we are exercising, 80% of our blood flow is going to our big muscle groups that we are using to create the exercise, to create bigger muscles, get the oxygen to those muscles so that they can work. And then everything else is just dwindled down to a little bit of blood flow to those just to keep them working. The vasodilators help increase that blood flow to those active muscles and to the areas that need the more oxygen and the more blood flow because it's being cut off, especially towards the heart. And diuretics help to get the extra bad stuff out through your urine rather than it being in your bloodstream and creating thicker blood, so your blood pressure will increase. Moving on to cardiac output, and cardiac output equals heart rate times stroke volume. So heart rate is split up to SNS and PNS, which is the sympathetic nervous system and the parasympathetic nervous system. Related back to the sympathetic nervous system is the accelerator nerve, and relating back to the parasympathetic nervous system is the vagal nerve. These both control the heart rate, whether it's going to be toned down or toned up or increased. So that's how the heart rate works. Stroke volume is split up into preload, contractility, and postload, which is basically just explaining the filling of the heart and how much blood is left behind, how much blood is ejected, and how the blood moves through the heart. So when one of these is increased, cardiac output increases. And as we know, when we exercise, our heart rate increases, so that accelerator nerve is activated through the sympathetic nervous system, which increases our heart rate, and that is how the cardiac output is increased and stroke volume is increased, because of the amount of blood flow that we are pushing through our heart, because our heart is beating many, many, many more times per minute. The overall cardiac output will increase, and then we will have increased venous return to the heart, which is augmented by skeletal muscle, and an enhanced venous return enables cardiac output to increase by preventing a fall in cardiac preload, which we can see through stroke volume that would occur as heart rate and inotropy increase. So it all runs together, the cardiovascular response to exercise, and this will be affected for our patient because of the myocardial infarction and the bypass surgery that he has. But this is how our cardiovascular system responds to exercise. So we will use this to determine what our client will be able to do and what they will be able to use. So through this video, we were able to talk about myocardial infarctions, bypass surgery, vasodilators, diuretics, exercise precautions and tolerance for our patient, and cardiovascular response to exercise. So through this video, we were able to help our patient. Thank you for watching.